Cancer Survivor Day really brings to the forefront a lot of our core values here at the Mayo Clinic. And the Mayo Clinic Cancer Center, we really focus on the needs of the patient coming first, and particularly the needs of the cancer patient coming first. So that includes many things. It not only includes trying to get rid of the cancer, clearly that's a core part, diagnosing, treating that cancer, but treating the whole individual as well as helping them become a cancer survivor, meaning that they not only put the cancer in the rearview mirror of their lives, but that they help to recover and they help to really get on with their lives in a safe and healthy way. Cancer survivorship is a term that's really expanded in a lot of ways. In the past, it meant truly individuals that had undergone a treatment and we believed their cancer was cured, and we were now monitoring them for relapse and helping them to recover. We recognize now that the themes of cancer survivorship, which include recovery, which include supportive care, which include many aspects, both physical and emotional, really are relevant for all cancer patients. So whether they're undergoing treatments, whether they no longer need treatments and their cancer is gone, whether they have a chronic cancer that will never go away but they live years with, we view that everyone is a cancer survivor that has had to battle cancer. So I came up with these tips for cancer survivors, really trying to crystallize some of the lessons really I had learned from patients. What are the things that have been helpful that I've seen that patients have drawn upon that really have been a resource for them. So the key tips I learned from patients, I'd say number 10 would be to learn more about your disease. That knowledge of, what is your disease, what are the options, so that you're an active part of the decision-making process is really key. Number 9 is really feeling part of a community, making friends with others that have a similar challenge, whether it's cancer as a whole or whether it's your specific cancer. That balance, that perspective, those people to ask who have gone through it are a great resource and really complement your healthcare team. Number 8, be your own best advocate. Indeed, in terms of many times in the cancer treatment process, there are decisions to be made. Understanding those decisions, advocating for yourself, or if you don't understand something, feel free to raise your hand and say, I don't understand this. And things really shouldn't move forward from that point until you really understand what your options are. Number 7, capture what's discussed at your doctor's visits. These visits might be 15 minutes long, 20 minutes long, 30 minutes long, but they tend to be very dense in terms of a lot of information, and it's difficult sometimes to remember all of that. You want to be able to capture that. Sometimes you might want to tape that. Clearly ask your doctor before you tape them, but now every smartphone will have an app that you could tape them, and I welcome my patients to do so that they can listen to those things again and again, they can take notes from that, and importantly, they can share that with a loved one if they were not able to be at the visit with them. Number 6, take care of your caregiver. Now that caregiver might just be emotional support, it might be your loved one, it might be a spouse, might be a friend, it might be somebody that really has to help you physically if you're having difficulties. Sometimes we have to rely on our caregiver to a great degree, sometimes less. But taking care of that individual is key. Number 5, take care of the rest of your health. Sometimes when we have cancer, it seems to be so overwhelming that everything else pales in comparison. And with our health, it's really key that that not be the case. If we have high blood pressure, if we have diabetes, if we have heart disease, lung disease, whatever that is, none of that unfortunately goes away. And it's important that that be well taken care of at the same time, or it might impact your ability to get your cancer care. So these things never occur in a vacuum. They really are interrelated. Number 4, eat in a healthy way, at least most of the time. And sometimes I have patients that go a little bit, overboard, and they go onto some draconian new diet that is, super, super strict. Shouldn't be the case. Clearly, if you're undergoing difficult cancer treatments, sometimes our first goal is just making sure that you're eating enough. Are you drinking enough? Are you getting enough calories? Number 3, be active. For some people, that's exercising, going to the health club. Maybe it's yoga. Maybe it's walking. Maybe it's going up and down stairs. People say, boy, I don't feel well. I don't really want to be active. What we find ironically is the more active we are, the better it helps us feel. Now, clearly, whatever activity you have when you have an illness, it's important to really talk about that with your doctor so that they're in agreement that that's at an appropriate level. But it really is very important and is a key way of battling fatigue that is a common side effect both of cancer and cancer treatments. Number 2, live every moment. There's one thing we learn about from cancer patients who face difficult times is that life is about special moments. It's about a daughter's wedding. It's about a son's bar mitzvah. So we all should be really living our lives, truly happy with where we are in the journey, not always waiting for the future to be that special moment. And the final, and this really ties in with number 2, is number 1, focus on relationships. Without question, as someone who's really had truly the honor of being able to be with individuals as they face the end of life, it becomes very obvious that the end of life, what matters to people are the relationships that they have. It's not possessions, it's not career accomplishments, it's not prestige, it's people, and knowing that is the core at the end, really helps to inform the entire journey.